Chronic obstructive pulmonary disease is a type of chest condition. This is a lung disease that happens to people when they smoke. So this is a condition where there is inflammation, there is scarring of the lungs, and you know what happens? The airways, that is the windpipe through which the humans breathe. In those windpipe, there happens obstruction. So the airflow is not smooth in these patients. So obstruction happens, and that is why there are a lot of symptoms these patients suffer with. And as well as with the obstruction, there is destruction of the alveoli. Alveoli are basically what? These are the end spaces. You know, when the air moves from the nose to our pharynx to like lower down into the windpipe, then that is the last point where the air goes. That is, these are like the small pockets called as the air sacs. That are the alveoli. So in COPD, that is the short form of chronic obstructive pulmonary disease. So there is destruction of those alveolar sacs, as well as there is obstruction in the windpipe. So these two things are happening in conjunction with each other, leading to the picture that we all know as chronic obstructive pulmonary disease. Asthma and COPD are two different diseases. Definitely both are affecting lungs, but asthma is an allergic disease. It can affect young, small kids. You know, you can get patients, you know, as small as 2-year-old. They can suffer from asthma. Then you can have teenagers, then you have mid people of 20, 30, 40. So 50, 60, 70-year age group. So it affects all age groups. While COPD is a disease of older age group people, you know, who have smoked, who have used biomass fuels, who have been in contact with industrial factory smoke for 20 years, 30 years, and down the line, then they develop symptoms of breathlessness. So that is COPD. Elderly population, COPD, and all age groups, that is asthma. And asthma is basically an allergic disease. So it affects the windpipe, only the windpipe of the people. It is hyperreactive. So it, you know, whenever the allergen hits the windpipe, it hyperreacts, it constricts, just like this. This is a normal windpipe. And, you know, when it shrinks, the allergen hits it, it contracts. And after some time, either you take the inhaler or you take steam, or naturally it expands and becomes enlarged again. So this patient starts getting relief in few minutes, 15 minutes or half an hour or so. So it is a transient process. It is not progressive. The symptoms are not present all throughout the year. There are seasonal problems. There are some patients who do have perennial problems, but that are only present when they are in contact with the allergen all throughout the year. So allergens also, they are of different variety. Like there are house dust, then there are pollens, then there are house dust mites, then there are animals, there are animal danders, there are in fact some medicines, some food items also. So all these varied environmental factors, they can cause allergy to the patient, and then the patient start having a hyperreactive phenomena in their windpipe, and that leads to the constriction of the airways, and in due course of time they expand again, and then again if they come in contact with the allergen again, they constrict again and they open again. So this cycle keeps on repeating it in itself. So when the patient is away from the allergens, he's completely fine. So he can like go on to climb Mount Everest also. But when he is in contact with the allergen and when he's having this constricting phenomena of the windpipe going on, then it is difficult for him to walk even 10 steps. So that is the major difference. So in COPD, the symptoms are progressive. They keep on happening. There is no one time when the patient is completely all right. While in asthma, it happens in phases. Patients, when they suffer from chronic obstructive pulmonary disease, they suffer from breathlessness. And that breathlessness progressively increases. Yes, that is the bitter truth. That is the sad truth. So it progressively increases with time, as well as the patients keep on complaining of breathlessness. First, they start with the feeling of breathlessness while they are walking the staircase. Then they start complaining of breathlessness even while walking 100 meters, then 10 meters, and later on in the stages when the disease progresses, the patients complain of breathlessness even on sitting down, sitting at one place. So apart from breathlessness, the major symptom that COPD patients suffer from is the cough. And cough is majorly productive. That is, a lot of sputum comes out, and that sputum is also various colors like white, yellow, brown, and green. So there are different kinds of varieties of sputum, and as well as the patients are also very, thin build, cachexic, they are anorexic, so they are very thin build. And other symptoms that keep on adding on during the process of COPD are the infections, the super added infections, where the picture gets, added symptoms like fever, then chest pain, then rhinorrhea. These are all symptoms that keep on adding once the COPD patients suffer from any super added infection. COPD is basically a disease that we depict, that we use the terminology for smokers. So it is the smokers who smoke either cigarette, bidi, hookah. So in any form, if the nicotine is going into the lungs, then the disease that is caused by that is called as COPD. So any type of smoke, but the most common type of smoke is the nicotine exposure. And that is the most common thing that is happening in the developed countries. But while we are talking about India, while we are talking about the developing countries, then the most common cause is also the biomass fuels. So biomass fuels is one exposure that is seen in our rural areas, where the ladies, they burn chulha, they use biomass fuels. So that smoke is that blackish smoke that taints the walls of the kitchens of the ladies, and that same smoke gets accumulated, gets collected in the lungs of these persons, and it causes the disease that is COPD. So apart from these two major causes, one is the tobacco inhalation, second is the biomass fuels. There are other causes also that can lead to tobacco, that can lead to COPD. And one of the major causes amongst these is the factory smoke, the smoke that comes from the industries, that comes from the burning of various fuels. Then there are many industries that pass out multiple chemicals, and that burning of those chemicals, those waste, those materials, those products, that leads to fumes, and that in turn also leads to this disease that we know as COPD. Although it is a progressive disease, as I had told you before, but the good thing about it is that it is treatable. The symptoms are very easily treatable, and the patient's quality of life also keeps on becoming quite good, despite, if you see the progress, that is, you see the amount of destruction in the lungs. If you compare it with the quality of life is quite good of these patients. But the complications these people suffer are like systemic complications. The disease can affect other systems also. Like most commonly, these patients also suffer from gastrointestinal problems. For example, you can say that these patients have gastric reflux, burning sensation in the chest, because what we call as the gastroesophageal reflux disease, GERD. So that is one of the most common things these people suffer. Then there is, as I had told you, there is loss of muscle mass in these patients, as well as there is a lot of sleep problems. There are other system disorders, like there is depression, anxiety, and all of these are generally complications of COPD. So COPD is one disease, but it affects many organs per se. There are multiple array of tests that are available with us. First of all is the detailed medical history of the patients, that is followed by the physical examination, that is the stethoscope that we use, as well as looking at the physical picture of the patient. That helps in guessing the diagnosis or getting to the hint that yes, probably this patient is suffering from a COPD, and detailed history coming from the fact that if the patient is a smoker, or if there is a lady who's giving the history of using biomass fuels from last 10 years, 20 years or so. So all these histories build up a diagnosis and help you build up a diagnosis, and later on these hints then can be concretely investigated in the form of valid investigations. Like one is the first foremost is the chest X-ray of the patient. Now, chest X-ray of the patient of COPD typically shows hyperinflation of the lungs. So the lungs, what is hyperinflation? That is the lungs become inflated like a balloon. So this happens while the air spaces, the last alveolar sacs, they are damaged. So the connections between the alveoli, they get damaged. So the alveoli, they get dispersed. They lose the link between each other. So when they are dispersing, they inflate. And so the lungs of the COPD patients are quite hyperinflated, and they are quite long and bulky. As well as apart from X-ray, then we have got beautiful test of pulmonary function tests. So these tests contains one test, that is spirometry. So when we ask the patients to perform spirometry, then a very beautiful picture of obstruction is evident on the results. So that in itself helps us. Now, if the patient is also complaining of cough, sputum, then we get the sputum examination of the patient done. Then we can get the cultures like pyogenic culture, then gram staining. So, and COPD patients also can suffer from other illnesses, like other infective illnesses like tuberculosis. So we also go on with, if there is a lot of sputum coming, then go on with sputum for AFB, that is acid fast bacilli, that also we go ahead with. So there are multiple array of testing, and all these tests help us to build up the diagnosis and treat the patient correctly. When we perform the spirometry and looking at the X-ray of the patient, the picture looks very bleak. So, but when we start treating the patient, the quality of life improves. The patient generally has got lots of treatment, symptom relief. So the patient is quite well off with the treatment. So multiple array of treatments are available. So, for example, bronchodilator. So, a lot of inhalers are given to these patients. The inhalers are the medicines in which, the medicine goes directly from the mouth to the windpipe to the alveoli. So, just by one puff, two puff, or, using the DPIs, that is dry powdered inhalers. So, using those capsules, so you can get the drug administered right into the airways, windpipe. And so that is the major line of treatment for these patients with wonderful results. And apart from that, there are other drugs that are given to provide symptomatic relief in the patient's breathlessness. So in toto, they are one of a kind of a magic therapy for COPD patients with amazing and fantastic results. Looking at the causes, as we had seen that it is mainly due to smoking. Yes, how it can be easily prevented just by, if you propagate and if you educate and if you dispense the information that, smoking is unhealthy. It can cause ill effects. It can cause diseases. You can have really bad results in the future. So, if we can propagate this information and we can stop people from smoking cigarettes, smoking hookah, smoking e-cigarettes also. E-cigarettes are now in trends that saying that they are not harmful, but that is not true. E-cigarettes are causing as equal as harm as our normal cigarettes and BDs. So, educating the youth, educating the general public about the ill effects of smoking can definitely prevent this deadly disease from forming and propagating. And another thing that, educating the rural people to stop using biomass fuels, switch over from biomass fuels to the our gas, LPG gases. So that system can also, prevent this disease from forming, because although the patients are symptomatically better, but if you see in the long run, the morbidity and mortality due to COPD is definitely very high. And in fact, if we talk about our country, India, then it is the second top killer of our country, of our nation. So in the long run, patients, do tend to like deteriorate due to super added infections, and they like need a semi ventilator kind of thing for their homes to survive, to breathe. That semi ventilator form is called as the BiPAP. So, educating everyone about the outcomes, the consequences of smoking, that is very important. And in fact, it is very mandatory for today's generation and the general public in total.